Obesity is a major public health problem today. It is the leading cause of death and disability worldwide. Obesity affects not only adults, but it also affects adolescents and children. It is an invitation to ill health. And clinically, obesity is basically excess of body fat. It is assessed by two parameters. Number one is the body mass index, and number two is the waist circumference. So, first of all, about the body mass index. Body mass index is weight in kilogram divided by height in meter square. And when we assess obesity based on body mass index, a person who has a body mass index from 18.5 to 24.9 is considered to have a normal body mass index. And in the case of Asian population and Indian population, the normal body mass index, the body mass index of a normal person should be up to 22.9. Anybody who has a body mass index greater than 25 to 29.9, and in the case of Asian Indian population from 23 to 29.9 is overweight. A body mass index greater than 30 to 34.9 is obesity grade 1. From 35 to 39.9 is obesity grade 2. And a body mass index greater than 40 is obesity grade 3. Now the question is, what about the waist circumference? What is the importance of waist circumference? Now it has been shown that apart from the body mass index, what is equally important or even more important in terms of the risk of various diseases is the intra-abdominal fat. And that is why, apart from the body mass index, the other criteria for assessment of obesity is the waist circumference, which is measured slightly above the belly button. Now, the waist circumference in the case of females should be less than 80 centimeters, and in the case of males should be less than 94 centimeters. Now, depending upon the body mass index and depending upon the waist circumference, whether it is only one of the criteria which is being fulfilled or both the criteria of obesity are being fulfilled, the management of obesity will comprise of lifestyle intervention and also medicines, and in certain cases, surgery can also have a role to play. But the most important thing is the lifestyle intervention. Now, what exactly is the lifestyle intervention? So lifestyle intervention is basically reducing the caloric intake. A calorie reduction of 500 to 1,000 kilocalories per day can help in reducing the body weight of up to 0.5 to 1 kilogram every week. So a person has to target a weight loss reduction of around 2.5% every month and around 15% in 6 months. What is even more important is to be able to sustain this weight loss. And in some of the diseases, it may be beneficial to have a weight loss of up to 20% or even more than 20%. So this would require consuming foods which are less in density, less in energy density, the low caloric foods, the foods which have got a high satiety index, basically foods which are rich in protein can help here, avoiding the snacks, avoid skipping the breakfast, avoiding eating at the night time, and avoid consuming drinks which have a lot of calories. So these are some of the things which can help in terms of reducing the caloric intake. Another thing is increasing the physical activity. So physical activity has to be increased to around 150 minutes every week. And apart from moderate aerobic exercise, resistance training up to 3 sessions or 1 to 3 sessions in a week can help. Now, there are people who say that they consume very little, still they are not able to lose weight. And the reason here is that as such, the basal metabolic rate of the body is less, which basically means that the energy expenditure which is happening under the normal circumstances in their body is less than compared to other people. because there are genetic differences also, which result in differences in the basal metabolic rate between person to person. So in such case, apart from reducing the caloric intake, apart from increasing the physical activity, these people may consume foods which can increase the metabolism rate. So these are some of the things which can help in achieving weight loss, achieving reduction in the body mass index, achieving reduction in the waist circumference to normal level, and thereby reducing the risk of variety of diseases like type 2 diabetes, hypertension, dyslipidemia, gout, osteoarthritis, infertility, polycystic ovarian disease, and most important, a variety of cancers. Around 20% of the cancers are known to be associated with excess body weight and obesity. Thus, it is important for everybody to be conscious about their body mass index, to be conscious about their waist circumference, and target to reduce them to the normal level. And with determined efforts, it is possible for everyone to achieve the target levels of BMI and the waist circumference.